Hello everyone, my name is Nicole Getz and I am a BSN nursing student at Indiana State University. Today we will discuss nursing homes during COVID-19. The population at risk. In this discussion we will focus on the nursing home population and healthcare personnel. The resident population within the facilities are older adults with underlying chronic medical conditions. This places the population at a high risk of being affected by COVID-19. The healthcare personnel that work within these facilities are also then placed at risk. Our learning objectives. At the conclusion of this activity, participants will be able to identify precautions taken in the facility, as well as actions taken to protect the population and healthcare personnel. Recall healthy ways to cope with stress during the COVID-19 pandemic. Recognize the strategies used to optimize the supply of personal protective equipment during shortages. Classify the use of personal protective equipment during capacity strategies. Please stop the presentation here and take the pretest in the link below and return when you complete it. Welcome back. Infection control and prevention. A strong infection control and prevention program is critical to protect the residents and healthcare personnel. This should consist of a minimum of one individual with training in infection control and prevention working full-time hours. Restrictions on group activities and visitation is also necessary to protect the residents and prevent the spread of COVID-19. Education and prevention. Residents, healthcare personnel, and visitors need to be provided information about COVID-19, which includes signs and symptoms of COVID-19. Information on managing stress and anxiety should also be provided. It is natural to feel stress and anxiety, especially during the COVID-19 pandemic, but there are healthy ways to cope with these feelings. It's important to take breaks from watching, reading, or listening to the news. Take care of your body, eat healthy, exercise, get rest, avoid alcohol and tobacco, make time to unwind. As a healthcare worker, you are better equipped to take care of others if you take care of yourself. Regular review of the CDC infection control guidance for healthcare workers is imperative for current information and updated guidance. Educate all individuals within the center. Sick policies for staff should be reinforced, and the healthcare personnel should not report to work if feeling ill. Reinforce importance of hand hygiene and the importance of personal protective equipment. Educate residents and families on any updated information and the action taken by the facility to protect the residents. Let's discuss some additional precautions. Source control measures. This means healthcare personnel should wear a face mask at all times. Residents and visitors also need to wear face coverings. Residents need to wear a face covering whenever leaving their room, unless certain conditions apply, such as they have trouble breathing or they're unconscious. Visitor restrictions will also be necessary to prevent the spread of COVID-19. COVID-19 testing is necessary for residents and healthcare personnel. Manage healthcare personnel. Implement sick leave that is flexible and consistent with health policies and not to be punished. Personnel should monitor for fever and be screened at the start of every shift. A plan will need to be developed for staffing shortages due to illness and absenteeism. Provide necessary supplies. These include supplies for hand hygiene and cleaning and disinfecting. Personal protective equipment is also necessary to care for residents with COVID-19. Dedicate a space for residents with COVID-19. Create a plan for admission of patients with COVID-19. Strategies to optimize supply of personal protective equipment. Conventional capacity, contingency capacity, and crisis capacity. The conventional capacity is a strategy that should already be in place for general infection prevention. The contingency capacity is a strategy that can be used during periods of shortage of personal protective equipment. The crisis capacity is a strategy that is to be used when the personal protective equipment supply cannot meet the utilization rate. In emergency situations, as with pandemics, changes are necessary to continue to provide high-quality patient care. The strategies are used to ensure healthcare personnel to have access to personal protective equipment. Within the different phases, there are different strategies used. In the conventional phase, we use physical barriers. We limit outpatient visits. We utilize telemedicine. We limit the healthcare personnel. We limit face-to-face visit, and we limit visitors. In the contingency phase, we selectively cancel elective and non-urgent procedures, and we decrease length of hospital stays. In the crisis phase, we cancel all elective and non-urgent procedures. We also have different phases for our personal protective equipment. In the conventional phase, utilizing the N95 mask, we just-in-time fit test. But during the contingency phase, we temporarily suspend fit testing, and we extend the use of N95 respirators for contact with several patients. In the crisis phase, we will use the N95 respirators beyond guidelines, and also we will prioritize the use of N95 respirators. Face masks in the conventional stage we will use according to guidelines, but in the contingency stage we will implement extended use. Gowns in the conventional stage we will use gown alternatives such as washable gowns. In the contingency phase we will consider the use of coveralls. In crisis capacity we will extend the use of isolation gowns and consider other gown alternatives. Eye protection. In the conventional stage, we will use according to guidelines. In the contingency phase, we will extend the use of eye protection. And in the crisis phase, we will prioritize the use, and we will also consider safety glasses. This takes us to the end of our presentation. Again, my name is Nicole Getz. I am a nursing student at Indiana State University. I want to thank you for listening, and please take the post-test in the link below, as well as check out the handout to review our learning objectives. Thank you.